Okay, I'm going to begin with this lecture on cultural sensitivity. This is chapter 10 in your Rollins book. This first slide talks about culture, and according to Levine in 1988, across cultural groups, parents hold common general goals for their children, such as survival, health, skill development, and social acceptance. Specific parenting strategies for meeting children's needs vary between cultural groups. Communication styles and values vary from one cultural group to the next. And there are differences in play styles that have been noted in different cultures. Healthcare culture is rooted in Anglo-European beliefs, values, and practices, and are reflected in cultural courtesies and customs. It is a Western medicine philosophy it penetrates healthcare culture. In healthcare culture, the following cultural customs and courtesies are also reflected. The notion that all people are more or less equal. In other words, men and women are treated with equal respect. People freely express their opinions, and freedom of speech is a major characteristic of the culture. Persons are greeted openly, directly, and warmly. Following a greeting, eye contact is maintained and communication gets to the point. Social distance is about an arm's length and is typically maintained in interactions. People do not expect to be touched except for a greeting handshake. Punctuality in and responsibility for keeping appointments are valued behaviors. Time is valued and punctuality is expected. Some special considerations. According to Gill, in 2005, he outlines 3 important levels of responses that are needed to become cross-culturally competent. The first step involves personal sensitivity. This is a process that begins with becoming aware of one's own biases and values. The second level involves obtaining knowledge responsibility. When something new is learned, it must be practiced with accountability. The third level is the development of active competence, which follows careful introspection and leads to heightened sensitivity and awareness, which in turn elicits the desire to learn. The following tips are offered for working in a culturally diverse setting. Use culturally diverse toys and other items. View each child as an individual with unique characteristics and worth. Racial appearances do not indicate a cultural difference. When communicating, speak slowly and clearly. Use simple sentences. Use active verbs. Pause and repeat as needed. Keep communication content congruent. Use visual illustrations or photos. Act out or demonstrate as needed. Focus on nonverbal cues. Silence is as important as active listening. Check comprehension. Avoid jargon or slang. Inquire how children celebrate events to identify customs. Some feelings cannot be described in simple language. And then the activity for this week is called Origami Cranes. And this activity is, it's difficult. I had difficulty with it. You might even use a YouTube demonstration of how to fold an origami crane. But these cranes are Japanese symbols for good health, long life, and prosperity. And it is not uncommon to see pediatric patients in the hospital with Japanese inheritance or family friends, or community members who have made an origami mobile with 1,000 origami cranes to help protect and create a wish for that child. It's traditional in folding these cranes to string them all together with thread and put them into something that can be hung in a patient's room. And it's a beautiful sight when they are completed. Do have fun with this activity. Again, use maybe a YouTube video on how to create the origami crane. And this is a simplistic version, but there are other versions that can be a little bit more difficult.